Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Jesse Grote. Today's guest is RN Zoey Drew from Bryan Medical Center in Lincoln, Nebraska. Zoey completed the IONRP in September 2020 while employed by Regional West Medical Center in Scottsbluff, Nebraska.
Hello and welcome everyone. I have with me today Zoey Drew. Super excited to have a few minutes to visit with her here. So Zoey, if you just want to go ahead and provide a brief introduction, just your name, how long you've been an RN, and then what type of facility or unit you work on.
Hi, like she said, I'm Zoey. I've been a nurse for 4 years now. I currently work in Lincoln, Nebraska at Bryan Medical Center on a med-surg, kind of an oncology unit where we give chemo, have PCU patients and general care patients.
Is that where you worked when you were in the residency program?
No, I actually went back to Regional West after I graduated from Bryan, and I was Regional West residency program in Scottsbluff, Nebraska.
So how did you apply the concepts covered in the program to the area that you work in?
I feel like I applied the concepts covered in the program by helping me kind of transition smoothly into becoming a nurse and directing myself to care for the patients at a pace that kind of worked best for me. I used a lot of organizational tools to assist me in completing my nursing responsibilities, such as, for example, an S-bar during communication. This program also, I noticed, gave me a lot of confidence being surrounded by my peers to prioritize my care for the patients and use a lot of critical thinking when the patient's condition was changing as well.
Awesome. I love that. I think that's a part that I always enjoyed so much too, is just getting to meet with you guys monthly, because I was your site coordinator back then as well. So that was really cool. So if you want to go ahead and share, Zoey, what was your professional experience or your project focus?
Yeah, our professional experience focus was on patients coming back to being readmitted within those 30 days and trying to minimize that, doing the best we can as nurses to, at discharge, to give them all the education and everything they need to be successful at home and not be readmitted and to improve their health at home without having to come back.
And I remember too, Zoey, we were just talking about before we started recording, you kind of were in the program right when COVID was wild and crazy as well. So I know that threw a little bit of a wrench in things, but I think it also provided some support that you may not have had otherwise. So that was kind of a blessing.
Yes, exactly. I feel like we were a lot closer as nurses and we learned a lot more during hard times, and we learned to come together and help patients. I mean, we did every day, but I feel like it's just kind of that extra push we needed to come together as nurses and make sure patients got what they needed to go home successfully.
Awesome. So what did you find to be the most beneficial aspect of the program?
I feel like the peer interaction and communication around the different areas, because each one of us came from a different area of nursing, different floors and units. So each of us had different skills and experiences for our units to bring to the group, and which allowed us to have different perspectives, to help achieve our goals, which was really cool.
Awesome. Well, anything you'd like to share with current or future residents?
I guess my advice would be to always ask questions and utilize your resources available to you to become a better advocate for your patients, whether it be nurses, managers, providers, anybody around you. Because I know as a first-time nurse, there's a lot of intimidating scenarios. And in the end, we're all together for one goal, and that's for the patient and their health and well-being. So
awesome. Well, great to visit with you, Zoey. Thank you again for jumping on.
You too. Yeah, thanks, Jesse.